The National Demographic and Health Survey is a critical aspect that shapes the health and well-being of any nation. The significance of Nigeria Demographic and Health Survey, or NDHS, is shaping policies and driving improvement in the health sector. Cannot be compromised. As they are nationally representative of household surveys that provide data for a wide range of monitoring and impact evaluation indicators in the areas of population, health, and nutrition. Their surveys are not mere statistics on papers, but they represent the pulse of a nation's health and demographics, from maternal and child health to access to healthcare services, sanitation, education, and more. The NDHS provides a comprehensive snapshot of a society's vital aspects. In a country as diverse as Nigeria, understanding these demographics and health indicators is crucial. The aid policymakers, healthcare providers, and various stakeholders in making informed decisions as such unravel how these data empowers us to address health disparities, design targeted interventions, and create policies that truly serve all Nigerians will be our focus on the program. Thanks for joining us. I'm Ikaria Clinton. Welcome to Nigeria Today. Joining us in the studio to discuss Nigeria Demographic and Health Survey is Philip Osun, Assistant Survey Coordinator 2023-2024 Nigeria Demographic and Health Survey. Welcome to Nigeria Today.
Thank you very much, Karen.
Also with us in the studio is Bintu Ibrahim Abba, National Population Commission NPC Director, Planning and Research Department and Survey Team Lead. You're welcome to Nigeria Today. I will start with you, Bintu. Tell us what these surveys all about. You call it the Nigeria Demographic and Health Survey. So tell us, what is it all about? Why is it so important?
Well, the Nigerian Demographic and Health Survey is a project that is being funded by the United States Agency for International Development and usually given technical assistance by ICF International to help technical advice and other training and other impacts that could be given to the study process. Well, the Demographic and Health Survey is usually conducted every 5 years, and we've had a series of surveys conducted within the past 2 decades. We've been having demographic and health surveys from 1990 to date, and we've had, from 1990, we had another one in 1999, because as of 1990, the National Population Commission was preparing for the census 1991. Thus, the FOS then, Federal Office of Statistics, conducted the survey, and there was a long wait till 1999 when we had the survey conducted by USAID, UNFP, and other partners. After that, we started having it every 5 years, and since then we've not stopped. We've been having it from that 1999, we had it in 2005, 2003, 2008, 2013, and 2018. Now we're about to have the 7th round of DHS conducted thus far in Nigeria. However, the Demographic and Health Survey is a process that has been taking place over the past 37 years and more, and it's been conducted in over 100 countries worldwide as part of the DHS Global Program.
Okay. Thank you very much. I just like that analysis, because I was about asking for how was the duration and all of that. We just answered all my questions.
Yeah.
Now, Philip, now tell us, she said you started since 1990, right?
Yeah.
And we've had about, this is the 7th one.
Yes.
Okay, we're about to go into the 7th round. So what impact has he had over these years? We've been having this. What impact has he had on, and especially because it's health, especially our health sector?
Yeah. Thank you very much. So the Nigeria Demographic and Health Survey has provided very critical data to, as you said, keep an eye on the pulse of the health and demographic indicators in the country. Over the years, we've been able to keep track of important health indicators that has told us at each interval how the country is doing in terms of child health, maternal health. It has also been a crucial input in government planning for the health sector generally. So in disseminating each of the DHS, in each of the DHS rounds, we usually have trend analysis that sort of that provides that broad overview and also insight on how we've been doing. And also, not to mention that the indicators also helps us keep track of how Nigeria is doing towards each of the global goals, whether be it MDGs or Sustainable Development Goals as we currently are. So it has helped us over the years to sort of keep track of these indicators and has been an invaluable resource.
Okay, you were the assistant coordinator of these 2023-2024.
Yeah.
When exactly is this starting? Is this survey starting, or is it on already?
Yes, it is. It is on already. Yes, and the process for the survey has been in the making for more than a year now. Yes. So and then we just
It's usually a 24-month program.
Yeah.
It usually takes from training, from concept development, questionnaire design, training, pre-testing, training of interviewers, training of field work for the listing program where they have to go out, map and list out all the clusters that need to be visited during the survey. And you have to go through data analysis after collection of data, now go for dissemination. So it takes a whole lot of process that takes within the 24 months to start and finish the project.
Okay, I know in 2018 when this survey was conducted, the malaria, assessing the prevalence of malaria was top on the list, followed by maybe sickle cell and the rest. So this year, what are you looking out for?
So there are lots and lots of indicators in the DHS, and for example, we are looking at nutritional status of children. We're looking at the fertility rate. What's the current fertility rate in Nigeria? So yeah, there this maternal and child health indicators that are forefront. Malaria, we are not actually, even though we are canvassing for social and behavioral SBCCs, as I call them, on malaria, but then we are not actually doing testing for malaria because we have the malaria survey coming up soon. So
okay,
yeah.
Now, okay,
basically what happened with the malaria indicator is that we had the 2021 malaria indicator survey that's called NMIS. So we had that in 2021, and then just now around the corner we're doing the DHS. So we already have some information on that, and because the malaria prevalence period, is usually between October and September, before the December month, where you have the high prevalence of malaria. And because there's been some sort of delay in conducting this survey because of the the elections and all of that, so we couldn't have started the survey as early as we could have. Thus we couldn't put in or incorporate the malaria component into this particular round of survey. Ordinarily we would have had it just like we had in 2018, even though we're going to have the NMIS
coming soon. So for this one, we just have the social and behavioral change communication questions and knowledge about malaria prevention and the rest.
All right. So also in 2018, that was the first time Nigeria was kind of introducing the computer assisted personal interviewing, the CAPI. So that made it somewhat unique because you had rapid provision of data and all of that. So this year, what is unique about this survey? What new innovation has been introduced?
Well, for the DHS, each round we try to introduce innovative ways of ensuring data quality, and this round is not different. So for this round, for example, we are still continuing with CAPI, which is basically has become a global best standard now for data collection.
Okay.
So, but then we are also going to be adding additional layer of quality checks. Like, so before now, you would collect GPS just once within the cluster to wrap up the cluster after doing the interview. But for this one, we are collecting the GPS at the household level, and then when the interviewers are conducting the individual interviews, they will also collect the GPS. So, and then even during the household listing period, we also collected the GPS points. So all of this sort of triangulates to help ensure that, you know, we are collecting the best data that will be used for planning and policy making in Nigeria.
Okay, so Hajia, what is your target group this time around? I know you had the women and children, you know, the last time you did it, and of course, you know, so tell us, what is your target group?
Okay, you know, we have the target population for the DHS is usually women of reproductive age, and that puts into consideration women 15 to 49 years.
Okay, 49 this time.
Yeah. For the women. Then we have, for men, we are having 15 to 59 years of age. That's the target population. And the sample cuts across all the 774 local governments of the country. And then we're going to about 1,400 clusters. That's about 30 clusters, 30 houses per cluster. And we're going to go to about 42,000 households. So that's where we have the sample within the 774 local government areas representative across the country.
Yes, I was about asking about the clusters, because I know the last time it was also 1,400 clusters. So I was hoping it would be more this time, but you're still retaining the 1,400 clusters.
Yes.
So why is it so?
The difference is that the clusters are maintained, but the questions will be different, and more questions will be there, more indicators will be added, and then you can have, you know, and because we're using the same method of data collection, computer assisted, you know, so we have to now ensure that we have quality data, and that's where we are still maintaining the same sample size, but the questions are different, and the method we're using to canvass the information is also similar, but then we have more indicators.
The methodology. Talk about the methodology.
Yeah, so I'm just going to mention that for the clusters generally don't really change much, because they are systematically, there's this calculation going on, and then you get a minimum number of sample that you would require to get accurate and good data. So it's not necessarily better to have lots and lots of clusters, because during surveys you have to make a trade-off between, you know, the going very big and then, you know, having to do more monitoring, or even having, you know, introduce errors, or you keep it small, compact, and then but then the sample size is well and soundly chosen to be able to give us good quality data. Yeah.
Okay, so last time you had some international donors, that the USAID, we had the Bill and Melinda, you know, Foundation. So this year, who are we expecting to, you know, to fund, and who are the collaborators?
Okay, the collaborators basically they're the same USAID. We have UNFPA, we have Bill and Melinda Gates, we have Global Fund, we have UNICEF. So many other stakeholders are still, you know, picking up one or two components of what we need to put into place, and they're coming up with pledges that they want to assist the project.
Okay, so what do you expect from people you are supposed to meet? How has the sensitization been? Because just coming to somebody and asking certain questions, some people might be like, you know, because of maybe we have some religious barriers, you know, some people are not really that educated to understand what we are saying. So how do we intend to do this, especially in the rural areas?
Yeah, so usually in terms of the DHS basically, you know, involves bringing together lots of stakeholders, and then the people at the state level and the local government are part of this collaborative effort. So we ensure that, you know, the message of the DHS, that it goes down to the grassroots in terms of We have posters in the clusters we are going to visit. We have informational brochures for those that were at the national lunch. We shared those out. And then, we also have jingles in the different languages, so that even those that can't, that don't speak English, we have they can also get access to this information in their own languages. So we try to, and then we also have our offices, even at the local government levels. And then the listing, during the listing exercise, when the listers and the mappers got to the clusters, they also introduced the surveys to the community leaders and told them that, okay, people will be coming back to ask more detailed questions, so please, cooperate with them, basically. So these are some of the things that we've put together, and then also being here, I hope we can also appeal to Nigerians to also cooperate.
That is what you're doing. That is why I'm asking all these questions, so that people will hear and understand. Because even some people in the urban areas are yet to understand exactly what you're talking about. Let alone those in the in the villages, in the rural areas. So that's why it's important you're here. Tell us more about what role you want everybody to play in terms of educating. Because I have to understand before I educate the other person.
Yeah,
yes,
that's
exactly.
true. That's true.
So we expect all stakeholders, you inclusive, we cooperate with the interviewers when they come and give them truthfully whatever questions they ask, give the answers rightful, so that we can be able to have meaningful data, and we can be able to say that yes, this data is representative and is of high quality, and it's the truth that we're giving out, so as to be able to impact on the health policy. Program managers can be able to now put in their programs. Interventions can take place, because whatever we're bringing out is data that we've gotten from the general populace up to the grassroots level. And we expect that all stakeholders, all of us together, are able to participate in such that whenever we have people coming to us to interview, or also to ask questions about certain health issues, even education issues can also be tackled through this demographic and health service, because we ask questions on literacy level, so that people can be able to know what is good for them, what is not good for them. Because if you are educated, doesn't mean you have to be literally, being able to read and write, but your information is education. So we just believe that people are being informed appropriately about certain things that affects their life, their children, their health issues. All of those things are part of what the DHS is canvassing for, and it will be put into the document as at when due.
Okay. So, Philip, what has been the challenge, like in the past? What are the challenges that you face, in the field? Because definitely you must have some challenges going out to talk to people. We're talking about human beings here, asking them certain questions. Well, they will look at you and they'll be suspecting. So, what are some of the challenges you encountered in the past, and how do you intend to surmount these challenges this time around?
Well, I think one that comes to mind is the fact that the DHS clusters are randomly selected, the households that will be interviewed. So they cut across every length and breadth of Nigeria, including in the very hard-to-reach areas. So this poses some challenges sometimes, being able to really get to these clusters. But then we've been able to surmount this by ensuring that we use field-tested interviewers. At the MTC, we do lots of field work. So we have people that are very dogged and committed and dedicated, and then can get to these areas with also the help of the communities and everyone to be able to reach, to ensure that information is gotten from everyone in Nigeria that's selected for the interviews, no matter where they are. So that's one of the challenges, and that's how we... So,
Bintu, I know you have some other thing to say about it, because you've been there for quite a long time. So,
okay, way back when we started the DHS some years back, that's for instance the 2003 DHS, we were not able to maneuver our way into some of the communities. But over the years, we're able to now know that we can use the community leaders, and then we're able to now know that, okay, we can use the vigilante group, we can use, the religious leaders, So over the years, we eventually started having to work together with them, and we're able to now know that, okay, we have to take people that are from the environment to be able to go into the environment. So we engage people, locals from the area, and then we now realize that we need to use local guides, because there are some areas or some communities, if you go, even if you're from there, the fact that you don't belong to the society, for instance, if you go to your home place, you're not always living there. But when you get there and you have somebody who is already living in there, and you engage them as local guides, they take you from door to door, and they talk with the other community members, I have interface with them. So these are some of the things that we've been able to overcome over the years, so that we can be able to now move in freely with some of the locals and engage them. At the same time, we were able to, over the years, see that we're talking to people with their native language gives you better results. So we started translating the languages. Far back at 2003, we've been translating languages. Gradually, we've been evolving the method of translation and seeing that we have different dialects involved. So we've been able to train people and use translators to give us the best, method or way of discussing with the people around the local members. So like in the South, for instance, we used to use, we were using the Pidgin language, and then we eventually got to know that, okay, the Pidgin language was not the best way to get, because everybody that speaks a Pidgin language also understands the local language, and everybody that speaks the conventional English language understands the Pidgin language. So we had to drop using the Pidgin language in the South, translating. We used it, but we stopped translating the questionnaire into the Pidgin language. So these are some of the things that we have been able to put through over the years to see that we now have, and with the computer-assisted, personal interviews, it's giving us easier, faster way of, capturing data and analyzing data. Real and lifetime data is being collected and, analyzed and given back to program managers and policymakers to be able to now put in place whatever policies and programs that need to be in place.
Okay, so Philip, I didn't want to ask this question, but then something in me said I should ask. In the past that you've done the survey, what are some of the findings that are kind of worrisome, that you think that something should be done about it, maybe as a matter of, as a way of behavioral change or something? So tell us, we ought to know, right? We have to know so that we can also, with this.
Well, so for as the MPC, as a data collecting organization, we try to basically not make inference on the data we are collecting.
Okay.
So we just
collect. She said it. Yes. Behavioral change.
Yeah.
So and it's always difficult to have behavioral change, and that's the human nature resists change. So that's one of the big challenge, because most of the things that we need to change, especially our attitudes towards health, seeking behavior at the local level, is always very difficult, because the local person sometimes with hardship and the way hard to reach places can easily get to the health centers. They resort to using traditional medicines or some other methods of having themselves treated. So these are some of the things that we need to change, our behavior towards health seeking from our local people. Even some of us.
Thank you very much. I was also expecting you to tell us to, have a good hygiene because, All right. Thank you so much, gentlemen and lady. Thank you so much for coming. That's it on Nigeria Today. We want to thank our guests, Bintu Ibrahim Abba, National Population Commission Director, Planning and Research Department, and Survey Team Lead. Thank you so much for coming on the program and sharing your thoughts with us.
Thank you.
And also a very big thank you to Philip Osong, Assistant Survey Coordinator 2023-2024 Nigeria Demographic and Health Survey. Thank you so much.
Thank you very
for sharing your thoughts with us.
Thank you very much. Thank you very much.
And thank you for being part of it. Don't forget, Nigeria Today airs weekday at 7:30 p.m. on NTA News 24. You can also watch these and other episodes on www.youtube.com/NTA News 24. Once again, thank you for watching. I am Eucharia Clinton. Goodbye.